Hello. Can everyone hear me? Am I audible? Hasnan, Aksa, could you just confirm that I'm audible?
Yes, Amara, you're audible.
Okay. So hi everyone, my name is Omer. I'm a fourth year med student at AKU, and I'm really grateful to medschool.pk and premed.pk for letting me host this session. So as you all know, we're very fortunate. We're going to talk to two of our colleagues who recently matched into psychiatry in the US. We're going to ask them about their journeys through med school and what really made them choose their path and how they got to where they are. So before we begin, let's do some introductions, meet, greet, consent. So Dr. Mahnoor Yusuf, are you here?
Yeah, I'm here. I can't see my video for some reason, which is weird.
So you are visible to us. I think the gallery view could be changed. And okay, so Dr. Mahnoor Vakar is here as well. So our two speakers, as many of you might have seen on the poster, are Dr. Mahnoor Vakar and Dr. Mahnoor Yusuf Sheikh. So Dr. Vakar is a graduate of Rawalpindi Medical University. She's from the class of 2020. And interestingly, she actually completed a year of psychiatry residency training here, if I'm correct. And then Dr. Mahnoor Yusuf is also a graduate of 2020. She went to Dow Medical College and she's matched psychiatry recently. And I think these two, we're all really grateful to have you. And it's awesome that you're here to speak because you both show some of those core interests in psychiatry, but I think you also had very personal and different paths on how to get there. So we're really excited to talk to you today. And thank you for your time. So Dr. Mahnoor Vakar, would you like to introduce yourself a bit first?
Hi, sorry I was late a little bit, but so you gave the introduction. So I am currently going to start at Eastern Connecticut Health Network, and that is like a community psychiatry program that I matched into. And I am a graduate of Rawalpindi Medical University. I graduated back in 2020. Then I did 1 year of my house job over there, and I did like 3 months of psychiatry rotation as well, and that's when I knew that I wanted to do psychiatry. From the beginning, I knew I wanted to do psychiatry, but I think that is what made up my mind when I was doing that rotation over there. And then, so how everybody says that you shouldn't have breaks in your CV. So like due to my some circumstances, I had like a little bit of a break in my CV, and I had by luck, I just like gave my CPS part one, and so I had that in psychiatry. So I had the opportunity to apply for psych residency. So I did like 1 year of residency over here in Rawalpindi, Benazir Bhutto Hospital, Rawalpindi, and over there. And then I think, and I then did my US clinical experience as well. But I feel like that, for me, for during this match process, that was like, the I think for me was like the core thing that everybody asked me about, because like everybody wanted to know like how that sparked my interest in psychiatry, what I did over there, and how was my experience in Pakistan compared to the US. And so this is just like a brief overview that I have of my journey, and just excited to be here, and like I can further in the Q&A and everything, I can just like share my input on this process.
So that's awesome. That's a cool story. And so Dr. Yusuf, what about you? Could we know a little more about you and your journey?
Yeah, of course. Like everybody can see and hear me clearly, right?
Yeah.
Okay, great. Yeah, so I am actually a graduate of Dow Medical College, batch of 2020, and I was always interested in psychiatry. But I think what really solidified it was all the exposure that I got in civil. I think that's something that people who go to Dow Medical College are quite lucky in, because you get exposed to many different cases from a very early point in your career. And I think that is what really helped solidify my interest in psychiatry, because I used to see that there's like a huge majority of people who are suffering from mental health issues. And what I really liked was that there were so many people, especially the ones who were working in the psychiatry department at Civil Hospital. They were really passionate about making sure that these people get the best care that they can, in spite of the limited resources, and working with like very difficult conditions. So that just made me feel that, with the right kind of training and the right kind of support, there's so much that you can do. And clearly there is a need for it. And there are many people who are looking to make it work. And so if there is a little more support, and if you are trained better, then that just means that you can, even if you like, you can come back and you can give back to your alma mater or other institutions, etc. And I didn't have any work experience here other than like my house job experience, but I did have volunteer experience here at a mental health startup. I worked there for almost a year, and that I feel like that was a key factor in helping me secure interviews and even matching, because that was something that was extremely talked about. And I did hear from a lot of people that, this is unheard of. This is something that's quite new. We've not really had many people who volunteered in a mental health setup. And it's just, even bizarre to hear that something like this exists in a country like Pakistan, because, mental health is a huge taboo, just not just in Pakistan, but generally in the world. And so the idea that, oh, there is a mental health startup and you can work in that, and it is working to not just break the stigma around it, but also provide mental health care in a way that it is more accessible. That was something that was talked about in a lot of my interviews. And I feel like that is what really helped me stand apart from the rest of my applicants, because everybody who is applying is a great applicant. Like, they all have great scores, they all have a great CV, they all have a great application. So what is it that, that makes you stand out? And I think that is what was my biggest takeaway and my biggest learning from this. And that is the advice that I would give to like all the applicants who are thinking of pursuing psychiatry.
So it really sounds like in an age where research numbers are going up, step scores are going up, it's really your personal story and your personal investment that distinguishes you when you apply for the match. So something I'm interested in asking, it sounds like both of you came to med school with an interest in psychiatry and mental health. So as a med student, especially before your clinical exposure, what formed your perception of mental health? Why was it important to you? If that's something you want to share or comment on. Dr. Vakar, how about you go first?
Sure. So I think my personal experience from mental health, like interest in mental health, started really early because I had a very close family member who was suffering from schizophrenia. So I saw like, mental health right in my family. And at that point in Pakistan, like especially in early 2000s, mental health was something that was like, it was something supposed not, you're not supposed to talk about it. And it was very hard to like, get those medications. Like I remember getting like my aunt, she used to get her medications from like India because they weren't available in Pakistan at the time. Like it was that hard, like, and they were just like normal psychiatric medication, antipsychotics that we get over here. Like, it's an everyday routine now. And I think that was one of the factors that, was like, it was such a taboo and it was so much like intriguing. And apart from that, my mom's a psychologist, and she's not a clinical psychologist, but she teaches psychology. So when I had like it was just interesting sitting with her because she's a great teacher. So how she would behavioral psychology when she would be doing her lectures, and you like it was like a dinner table discussion in our household. How if there's something new, and she would just discuss it with us, and these are some like behavior patterns we see, and things like this. And I think that is just like simply started my interest in psychiatry. But like let me tell you that when I went into med school, I had like all of like it was just like in my first year I wanted to be maybe a dermatologist, in my second year maybe an ophthalmologist, in my third year I wanted to do surgery as well. I did like an elective in ophthalmology as well. Like I was all over the place. Like in my fourth year I went to UK, but I was like maybe I wouldn't experience that as well. So I did like an ophthalmology elective as well. And in my final year, I was like, maybe I would want to stay in Pakistan. So, I was all over the place. So it wasn't that I had, like, I knew I had that interest in mental health, but I think the whole interest solidified when I did like my house job in psychiatry. And that is when I think in my clinical, like, I got like that proper clinical experience that for me like spiked my interest a lot more, because I felt like that it is like a field which is very interlinked with everyday life. So I love this aspect of psychiatry that I can just talk about this with every other layman, and he or she would understand that, like for instance, not everybody is going to understand hepatitis, liver problems, but everybody is going to like want to know about depression and anxiety and all of those things. I felt like it's something that is relatable, and it just diversify my experience. For instance, like it's not even everyday life, but it has interactions. For instance, like forensic psychiatry has interactions with law as well. So I was like maybe it's something later maybe I can do that as well. So I like that it is very interconnected to everyday life, and like it has some intersection with other subjects as well. So I
Right.
felt like that over time, it just like solidified my experience, like from my personal journey and a little bit of the clinical experience I got. I think that for me solidified my experience to, that psychiatry for me is where I want to be.
So it really sounds like your personal interest in the field came from before, but it was that work experience and that patient interaction that told you, yes, this is what I want my profession to be. So, Dr. Yusuf, the next question's for you. So, could you tell us more about that startup essentially? How did that relate to your personal interests? And did it come before or after you decided to commit to psychiatry as your future job?
Yeah, so I think I'll give you a little context. I was actually supposed to apply last year, but then everybody that I asked, because basically I went for my electives in 2020, and at that time, psychiatry was not as competitive as it is now. So all the doctors that I was rotating with, I asked them, I said, like there are a couple of people who are telling me that because I want to do psychiatry, I have to make sure that I have electives in psychiatry, but I'm not able to find one because it's very difficult to find observerships or electives in psychiatry. But they would just say, no, we have so many students who matched in psychiatry with just internal medicine letters. And so you don't need to worry about it. And we can just write you a letter recommending you for psychiatry and things like that. So I just had that advice in my mind that I don't really need psychiatry specific letters. I don't really need a psychiatry specific CV, so to speak, just my general interest. And there are all these like certain things that you have to do, like there is a checklist, you need clinical experience, you need to do well on your exams, etc. As long as I'm fulfilling that, I don't need to go out of my way and find a psych specific elective, etc. But then when I was looking to apply in 2022, I started talking to my seniors and other mentors, etc. And they all said that, the landscape has changed significantly because COVID has really sparked people's interest in psychiatry. And now, I mean, you can apply, no one is stopping you, but it's a big risk. So we would advise that you really work on building a psych-specific CV. So at that point, I did have a lot of components in my CV that were dedicated to psychiatry. Like, for example, I was doing researches in psychiatry. I have a blog where I would often talk about mental health, etc. I had done 3 months of psychiatry internship at Civil Hospital, but I did not have psych-specific clinical experience in the US per se. And then I was not able to give my CK in time either. So then that timeline got pushed ahead. But I didn't know about the mental health startup. And I didn't know that volunteering is also something that you can put on your CV, because that's not something that's talked about, right? Like when it comes to CV building, you hear things like, oh, make sure you get lots of research on it, make sure you do really well on your scores, and make sure you have US clinical experience. Like Pakistan local experience is considered like lowest on the list. But then I'm thankful I had good mentors, I had good seniors. So one of my friends who matched in psychiatry, she told me that, listen, and I said, I can't travel to the US right away. I can't afford a postdoc, things like that. And this is a reality of the STEPS journey. Like not everyone has the same financial privileges, etc. So she said, what, like, why don't you reach out to the MDs here at Aga Khan and work with them? Like their letter is going to carry the same amount of weightage because they trained in the US system and people do take their word seriously. So then I started emailing doctors in Aga Khan. I had a couple of them reach out to me. So I started a research project with one of them. And then the other one actually said that, what, like, why don't you just come and work with us and we can figure something out for you, etc. And then she was the one who linked me with this startup. And she said that, we're just starting out. Any kind of help will be appreciated. And the good thing about working in a startup is that there's something to do. Like, you just have to show up and you'll find things to do. So I think it was all pretty organic. It wasn't that planned, but I definitely would say that this was something that came about later when I started talking to more people and they told me that, now the situation has changed, so you need to plan your CV accordingly, things like that. I'm grateful for that advice because that is what eventually helped me match.
Okay. So I think a really important takeaway there is that psych has gotten more competitive. More people want to do psych, and you really need to think about shaping your CV to demonstrate that interest. Is that correct?
Absolutely. And I think if you could show the NRMP stats, which will tell you what program directors are looking for. So for psychiatry, the number one factor is commitment to specialty. So, and the best way to show your commitment to specialty is to have a psych dedicated CV, right? Like all your experiences are in psychiatry, your clinical experiences in psychiatry. Scores are not as important as they are for other specialties. So that's something that people who are looking to apply in psychiatry should be mindful of.
Okay. That makes sense. So on that note, since we're now talking about applying to the US, was it always the plan from day one in med school, or did you have a point as a med student where you realized that I want to train abroad?
No, that was always my plan. Then Trump came and I got stuck in COVID in the US. So I was like, is it worth it? Should I not? So the political situation was sort of dictating my plan. But then in the end, I was like, okay, this is what I want to do. So I'm going to do this.
So, Dr. Vakar, back to you. If I remember correctly, you had some US clinical experience in the US, right, with psychiatry. So, could you tell us a bit, and this is especially for students who are interested, what are some of the differences you saw with how psychiatry is practiced there, what the patients see, how they present versus here? Was that a difficult adjustment? Were there any surprises?
I mean, like when you're going to a different system, yes, it is a different transition. But I think that like my experience in psychiatry helped me a lot in that transition over here, because I think that one of the prime skills that we need to learn in psychiatry is the history taking. Like it's quite lengthy, quite long, and like, it's not something very direct yes or no questions. Like you cannot ask anybody, do you have stomach pain? And they're not going to say yes or no. You have to like ask them about their family history and their like personal journey, and pick out those things. And you need to be a little bit skillful that how are you going to gain that history. Because I remember when I started my psych residency, when we had to like intake a patient history, it would take me like a good 2-3 hours to do it when I started it. But by the end of like 3-4 months, it like got to the point that I was able to do it in under an hour, which is usually how much like time you should be like doing it. But I think that's a skill you acquire with time. And I feel like that is something that helped me a lot, because once I was in the US, it was like my first week of clinical experience, and my attending was very like, okay, he would hand me out patients in the morning, and he would be like, you go take their histories, because those were the new patients coming in, and then I would discuss it with him, which is, I think, which came from the fact that I already had like that skill that oh, I could take that history. So I was like, my attending had that, I built that relationship very quickly with him. I was okay giving me his patients, and I would talk to them, and I would just like then discuss the patient with him, and then discuss the treatment plan. But there are a little bit of differences that how things work over there, because obviously like it is more there, the guidelines are followed more over there as compared to here in Pakistan. Like we do a lot of medications very blindly, so that is not something we do over there in the US. And then I felt like I was working in a government setup, so obviously we have patients who are coming in from a lot of diverse backgrounds. So there are a lot of patients, if you prescribe them escitalopram or anything, they don't really care. They just like take it from you, and they won't ask any questions. But over there, even patients who like, they come in and they're like very well read, so they ask you a lot of questions that oh, what are the medication side effects, oh, what are like what is like, how long do I need to take it for, or what are the consequences of it and everything. So you need to know all of those things. You need to be very well versed in all of those things to explain it to your patient, so that they are able to make a decision on their own. And then the patient autonomy was very different. For instance, over here in Pakistan, a lot of families come in and they have like a say in it, what the treatment is and how this should go on. But over there, it is patient autonomy over there that is valued a lot. So I felt like that was different. And then there are like the newer generation medications that are available. There's like a wide variety of medications that we study over here in the books, but we just study them over here to that extent. We don't have them over here in Pakistan. But I feel like that's a lot of variety, and that gives you a lot of clinical experience, because that's something I feel like I couldn't get that while I was in Pakistan. So I felt, and then how the rotations are like structured. You do addiction, you do geriatrics, you do like child and adolescent. Over here in Pakistan, there are not like a lot of setups who do all of those structured rotations. Like everything is majority of the setups, everything is just jumbled up together. As far as I know, like in Punjab and most of those places, it is like you don't get like separate geriatrics, separate child. Like I think the only separate thing that you get is child and adolescent, maybe to the most. Like you don't do separate addiction, you don't do separate geriatrics, you don't so separate consultant liaison psychiatry. You're doing everything on a daily basis, which I feel like I mean, like, I think the structure in the beginning is nicer to have because, you're spending more dedicated time and, you're like learning more from those patients rather than just like jumbling up, a lot of things.
Okay. So it
Yeah.
sounds like there are quite a few differences, and I think the thing that struck me the most was "Pad ke jana." Don't go without knowing your stuff, so you can do it right by your patients.
Yeah. I think that is very, very important if you're going for your US, like,
Yeah.
rotations. Yahan par to you can just go away with like, you don't know things. But over there, my attending would ask me so many questions that I was like, oh my God, like I knew a lot of things because I had like 1 year of experience. That's a good experience. But even then he would ask me questions and I'd be like, oh my God, I don't know. And it was so much studying when I was there, like he would ask me like side effects, and I don't know, my attending was like really good and he knew all of these things on his fingertips. I was like, I don't know, I was intimidated by him all the time. So I like, for me it was still over there a lot of studying because he would ask me questions and then he would follow up on those questions as well. So I mean, then I feel like, if you're going over there, make sure that you're taking something out of that rotation. So work hard, study hard, ask questions, and don't be intimidated by the questions you get over there, and just say it, you don't know, but study them at the end of the day and like follow back with your attending at the next day. I think that makes a good impression. So I think, like, pad ke jana to make the most of your time over there.
That makes a lot of sense. So, Dr. Yusuf, you're next. Um, in your interviews, and you can tell us perhaps how many you got, what how you ended up deciding how to rank them. But in your interviews, I think what really stood out to you, what do you think they wanted to hear about? And you touched on this a little in your introduction, but were there any standout moments in your interviews where you were like, you know what, yes, I've gotten through to them, I've really made a good impression here?
That's a good question. So I got 8 interviews, and all my interviews came in October. So when people are like, "Oh, there are waves," I did not have any waves. I just had like dhar 1 month, and then after that, my ERAS was radio silent to the point where I thought, okay, my application has like gotten lost somewhere or something. I don't know, like they're not seeing me or anything like that. Um, so I feel like all these people who are interviewing us, they are very professional and they really make you feel like you are it. Like, aapko to hum le rahe hain, So that was the vibe that I got in all of my interviews. Especially there was this one interview, and this was this place that I ranked as like my top choice. And like somewhere I knew that this is like a very competitive program. It's extremely unlikely that I'm gonna match here. But just the vibe that I got during that interview was that, matlab, hamara bas nahi chal raha, aap kal aake yahan baith jaye. They were just like, so nice to hear from you. You're such a lovely candidate. You're this, you're that. And oh, like a couple of people from that interview even said, oh, see you in July. And it's a good thing that like I had people who had warned me beforehand that, listen, none of this means anything until you get the email. So I knew better than to like believe them. But in that moment, I was like, oh, wow, like I've just done it. But I think if you like, so the first thing that I would say is that, like take all of that with a pinch of salt. Like they will be very polite, very professional, because that's just part of their training. Like you have to be professional, you have to be polite. So you will feel like, oh yeah, they really like me, I'm really vibing with them, things are good. Just take all of that with a pinch of salt. The other thing that I will say is that there are like these couple of things that I feel like did make me feel more comfortable, I would say, is when there would be like a point of commonality between me and my interviewer. So like, for example, one of my interviewers, her father was a Dawite. So that became like a common point for us. And she was like, oh, my father's from Dow, and his batch was the pioneer batch that made the blood bank and this and that. And oh, I said, my friend's father was part of that batch. And then turns out they both knew each other. So that was like a point of commonality. But this is like very rare.
Yeah.
But other than that, there are other things that you can find. Like for example, I had like this IMG, a doctor who was an IMG who was interviewing me. And so we connected over food, that, oh, it's like, we just want to be someplace where there are, halal food is easily available and we can find desi food just in case you're feeling homesick or things like that. So that became a point of commonality. So I think that was something that is, that generally means that your interview is going well. If you can like connect with your interviewer over something that is unique to the two of you, you can bond over that. For example, and then there was this one interview where they asked us like these really interesting icebreaker questions. So I feel like in those icebreaker questions, that sort of sets the tone for how the rest of your interview also goes. So like if you have a witty, smart answer to that, and you've got like your your interviewer laughing at that, then that exam ही होता है एक तरीके से
Yeah,
interview.
I think that was a Freudian
The
slip.
Freudian slip.
Yeah.
So that would be something that would make me feel like, yeah, okay, you know, we're off to a good note. Or like, for example, there would be some interviews, especially my first ones, I was a little nervous and I would be like, I don't think I'm like getting through to them. But then we would find something, like there would be something that we're joking about, something that I would say that would make them laugh, or we would find like something to bond over, and that would make me feel like, okay, yeah, now like I think I've sort of maneuvered this into a point where I feel comfortable, you know. And the other advice that I got was that if you can direct the conversation during your interview, then that means that it's a good interview. And that's something that comes with time. So like the more you practice with any and everybody that you can find. So like I practice with my juniors, seniors, mentors, people from different schools, etc. People I met online. So the more you practice, the better you get at like directing the flow, directing the conversation. That generally means that your interview is going well because you know what direction it's going in. Like for example, there was this one interview where the person who was taking my interview, he started taking my viva. He started off by saying that, why don't you tell me a couple of conditions, medical conditions that can also show up as psychiatric illnesses. And I was like, he's taking my viva. I didn't know this was going to happen. What the hell? But of course, I like answered his questions. And then he said, okay, you know, like, how do your parents feel about you pursuing psychiatry? How do your parents feel about you as a South Asian girl? How do your parents feel about you traveling halfway across the world, living by yourself? You know, so these were all very uncomfortable questions. And FYI, these are a red flag. They're not supposed to ask you these questions. Like, this is not a good program if they're asking you that. But in like at that point I was flustered, but then I said, you know, and he said, you know, what's something that you're like extremely proud of? So I said, oh, I'm really proud of my time at Dow. I was part of lots of extracurriculars, things like that. And he was like, okay, yeah, what extracurriculars? Tell me more about that. So then I was just able to direct the conversation to my extracurriculars and what I learned from that. And it like sort of went away from all the personal questions that he was asking me. So that I would feel like is when you feel like, acha, theek hai, I have decent interview skills. I think I'm getting through to them. Just like that.
So I think I got a couple of things from that, and you know, correct me if I'm wrong, but as someone look at this, trying to learn from it, I think the first thing was there is one aspect of the interview which is showing them who you are, you know, what your strength of things you've done, whether they want to work with you for like 3-4 years. And so I think the part you mentioned where you try to find common ground, you see if you can get along. I think it sounds like that's a really important part of the interview because they're choosing you not just because you're smart or because you're going to be a good psychiatrist, but because they have to put up with you for the next several years. And it goes both ways. I mean, you mentioned, you know, red flag questions. We as applicants also need to recognize that this is somewhere you're going to live. These are people you're going to eat with and talk to for years. So it's an important aspect of the decision. That was a really helpful answer. So thank you for that. And so one question that comes up, and both of you have touched on this, is it's difficult to get US clinical experience. It's possible, but it is a struggle. It's an uphill battle. So is it, with the increased competitive landscape, is it still possible to match without any US clinical experience, any LORs from MDs? Or is it that, you know, aapne khurid ke kuch nikalna hai, because it's just gotten difficult now? You know, we have to lay it straight. So Dr. Yusuf, what's your take on that? And then we can ask Dr. Vakar.
I would say it's not possible to match without US clinical experience. So I also have US clinical experience. I did end up doing it later on. But it was for just a month because that was the only one that I could find. And then after that, most of my clinical experience came from that which was not really clinical experience. It was a non-clinical job. It was a research position of sorts, and I was doing other things as well. But I would not recommend anybody apply to any specialty, let alone psychiatry, without US clinical experience. Like there have been cases, like I know somebody from Dow who matched in pediatrics without clinical experience, but that's the exception. It's not the rule. So I would generally advise that you should try to find clinical experience. Yes, it's an uphill battle. It's very, very difficult to find it, but people do end up finding at least like one elective, one observership, one externship. There is a lot of discussion around, oh, we don't want to pay for observerships, and we would rather like not pay for them. And I understand that, but if you can't find any other observership or any elective, and the only one that you can find is the one that requires you to pay, then I would recommend that you do that. You make that effort, because you are making all the efforts in every other place as well. You know, you're giving the exams, you're doing your research, you're doing other stuff. So this is a key component of your application. And like Dr. Vakar mentioned, they do ask you in the interviews, you know, how does the system compare between Pakistan or wherever it is that you're applying from, and the US. And because like we discussed earlier, that they want to see if you can settle into their system, if you are somebody who's used to their system. So if you have no experience whatsoever, then that can be quite difficult. And I think that there are a lot of programs that now have filters for clinical experience as well, you know, like in the number of months and things like that. So it is recommended. Even if you can get a clinic letter, it's fine. I would say that don't stress too much about, oh, am I getting a university letter, or am I getting a clinic letter? The quality of the letter matters, not the letterhead on it. If your letter writer has good things to say about you, if you have a strong letter, then that is going to speak for you. Because I was working at a clinic, and that letter was talked about, that, oh, you know, this doctor had really nice things to say about you, and it seems like you did come across a wide variety of cases, things like that. So that's not something that you should stress about, but definitely do try to get clinical experience.
Dr. Bakar, what are your thoughts?
I do agree with Dr. Yusuf on this as well, because I feel like now that everything has become so competitive and people are getting US clinical experience, it definitely is an uphill battle. It's not easy, especially psychiatry. I feel like it's harder to find, but it's not impossible. You can, if you like, you know, work hard enough, it's going to be like, you know, you start a lot early. Like if you want to do a clinical experience in like, you know, maybe 2025, like next year summers, this would be the time to start finding it, because it is going to take like a good 6-7 months to maybe find like 1 or 2 months of US clinical experience. And you know, you reach out to people, there are like a lot of opportunities available, but you need to like find that out yourself. I feel like this is a journey. Like for me, what I've learned during this process is like you have to make like a lot of effort. People are willing to help you, they'll help, like they'll make ways for you, but you need to like put that effort first. Like they need to see that, you know, you're willing to make an effort. I think we sometimes people come in with a sense of entitlement that, oh, you know, I'm here, then you need to give it to me. It's not like that. You have to work and you have to earn it. I think that is the one thing that, you know, your attitude needs to be like, you know, oh, I'm here, I'm willing to learn, and, you know, I'll take whatever you have. And it doesn't specifically like US clinics, clinical experience doesn't specifically has to be like a university experience or anything. Like I worked in like both of those settings were one was an inpatient setting, but that was like a private setup as well, and the other was an outpatient setting, and that was a private clinical like private clinical experience, like private US clinical experience as well. But that was the only thing I could find, so I took that opportunity and I did that, and you know, I matched with those as well. So you know, people how people say that, oh, we need to have like externships, or like, you know, we need to have university observerships only, and you know, otherwise we're not going for US clinical experience. I don't think so. That's true. You can work even in clinics and really stand out and get good LORs, and that would make up your application. But I feel like now that everything is becoming so competitive, you need to have that clinical experience, because they need to know that, you know, you have that diversity, that you can settle into that system as well. Because if you've not seen anything and you know how the US system works, because it is quite different from, whereas how are you going to like, you know, tell them that, you know, okay, yeah, we're ready to work in your system, and you know, we can adjust to those things, and we are like willing to learn. I think US clinical experience to some extent shows that, you know, you're willing to learn, you're willing to put in that effort, and you've seen how the system works, and you're okay with like, you know, the next couple of years that you know, you're ready to take up this journey. So I think that this is something that it is talked about in the interviews. So until unless you have this, you don't have that experience, how else are you going to like, you know, talk about it? Because they're experienced people, they can know if you're making up, if you're just making up stories, or if you've had like actual experience over here.
Okay. I think that makes a lot of sense, and it's really telling that both of you are like exactly on the same page about this. So, you know, these are just, I guess, the realities of applying to the US. You have to meet the criteria that they set. You have to hit a certain benchmark in terms of experience, in terms of knowledge. But a lot of other specialties, you know, one hears that with a lot of the surgical specialties, research is really the numbers. That's really what distinguishes some candidates. And so I guess besides US clinical experience, besides going and performing really well, did you get the impression from these interviewers or your application process that other parts of the CV are also becoming more important? Because Dr. Yusuf, earlier you mentioned that step scores are not as important in psychiatry. They seem to weigh your clinical performance a lot more. So, how important is research? And to everyone in the audience, the best thing to do is to always go and just check the stats yourself. NRMP releases everything. Go look at the medians, look at how many papers applicants are applying with. But, doctors Yusuf and Vakar, what are your thoughts, Dr. Yusuf?
Yeah, so I can just speak from my experience. Sorry about that. So I can just tell you from my experience, my scores were not that high. And this was something that I was really worried about because that's the number one thing that you keep hearing, right? That like your scores need to be amazing. Like anything less than a 250 is unacceptable. Like 250s, 260s, that's what it is. And so when I didn't get those, I was extremely worried that like, what am I going to do? I feel like my dreams of applying to the US have been shattered. But then I'll go back to this again, that I was very grateful. I had great mentors. I had great people who were guiding me. So all of them said, that's not the case. It's not over until it is over. There are ways to redeem this. So the one thing that I did was that I did do my step three, and I feel like step three is really important for psychiatry. I'm not sure for other specialties, but for psychiatry, having your step three done before your application is submitted or even during the interview season, that carries a lot of weightage, because in a couple of my interviews, they did often comment on the fact that, oh, it's a great thing that you're done with step three. It's so nice that you're done with step three. That's one less thing to worry about. I don't know what the logic is behind that, but this is something that was told to me by people who I was in contact with. And then I personally saw that as well. It was my personal experience as well. But the one thing that I will say again is the commitment to specialty. So that can take many different forms. It can take the form of research where you have done like extensive research in psychiatry. It can take the form of volunteer work. It can also take the form of clinical experience. It's generally better to have a holistic application where you have bits and pieces of all of these things going on to show that you are a holistic candidate and you can survive in any kind of setting. Like, because they want to feel like you'd be an asset. If you come to their program, you'd be someone who's willing to participate in research, who's willing to present at conferences, who's also not afraid to, be the first one to interview a patient, who's not going to fumble so much on calls. Like, of course, you will be guided and supervised every step of the way because it is residency, but they do want to see that, that ability to be proactive, to take initiative, to be a good team player. And your application is a way for them to gauge that. Of course, they gauge that more in the interview, but your application is like the first thing that they'd see about you, right? And the first impression that they make of you. Other than that, your personal statement also carries a huge weightage. My personal statement was talked about also quite a bit. So that's something that people who are applying to psychiatry, especially, I feel like they should start working on that earlier rather than later. It's good to like have a very solid personal statement because it is read in psychiatry and it does carry weightage. And if you open the NRMP stats, you see that is also like one of the top factors that program directors look at. So that would be something that I would really like to hammer home, that it's your entire application, which shows that you are dedicated to psychiatry. This is the only field that you want to pursue. It's not a backup. It's not something that you're doing because you got a low score and you just want to get into the system, things like that. And that is what is going to open doors for you. That was my experience.
Dr. Vakar?
Okay, so yeah, I agree with Dr. Yusuf on this one as well, because I feel like psychiatry is it's just not your US clinical experience, but they do want to see that you're like a holistic candidate. For instance, if you look at, I think it's the 2020 NRMP survey, which is about how the program directors view at the application. And it says that, for psychiatry, the number one thing that's most important is your personal statement. Like, it carries a lot of weight, because even in my interview, like they asked me about, oh, we really enjoyed your personal statement, specifically this line, like this was particularly my interview experience, or they had like my personal statement and they had read it so thoroughly, and it's like, we love this, and how, and can you like, they would ask me that, oh, can you like share more about your experience over here, how did this happen and how did that shape you? And these are questions they do ask you, and that is something I feel like is different in psychiatry from a lot of other specialities, because that is like for internal medicine peds, from the other candidates that they were there with me, it is important. Like their personal statement is important everywhere, but I feel like for psychiatry, it is the most important thing. And then apart from that, in the CV, I feel like your experiences need to be a little diverse as well, because for me personally, I think of the 10 experiences that I could choose was like, 3 or 4 were the clinical experiences, 4 were the clinical experiences that I added. The rest were those that I chose from my college experiences. For instance, I was like the president of the research society, so I did put that in, that I was in a leadership role. Apart from the researches, it was talked up about a lot. So like they talked about, oh, so how was your experience as the research society, like president of the research society? And that's something, or do you do like a lot of research in Pakistan? How's that experience? So I felt like they are interested in knowing about that, and I had like a lot to talk about, because then I had like a whole year of experience working over there. And then there was one thing that I did put in, like everybody, when I was like working on my CV, so like a lot of people said, oh, you don't need to put in hobbies, because last year's ERA CV didn't have hobbies in it. They removed that section. I believe this year they're adding that back in. So people said, oh, don't waste your experience on hobbies. But I was like, I think I want to add that experience. Like I want to add that, I have those hobbies. Like for instance, I added like I do swimming regularly. So like I added that I do swimming. And that I like I was like, I played netball all my like my medical college time, and like my school time as well. And how I'm interested in like just interested in baking and everything. So that is something that was talked about a lot, because they were like, oh, so do you swim? Oh, so, and I've like participated in a couple of competitions as well, so I did mention that as well in my hobby section. So they were like, oh, so do you swim, and how much, like what strokes do you know, how frequently do you do swimming? And oh, and they were like, people were like, oh, so you've been swimming since your childhood, that's amazing, that's that's something that we don't commonly see. And I didn't know like people in Pakistan do that as well, because I feel like people, they think of Pakistan is like a very backward area, and we don't do anything over here. So they were like so surprised that yeah, so they were like, like हमारे यहाँ कुछ भी नहीं होता उनको, they like this. There was something that stood out for me, and a lot of it, it was just like not one interview, but like a lot of interviews that it stood out that I was like very active in sport, and that is how I related to that. That is something for my like how they say that, how do you like at the end of the day, sometimes people ask you how do you de-stress. I was like, I like sport, I like activity. So for instance, for me, how do I de-stress is like I go for a swim, or I go for a walk. And that is something in my interview tied to my application. So I believe when you're working on your application, think a lot about what do you want to reflect from those experiences, like what part of your personality do you want to reflect, and what is it that you want your interview to know, like this is you as a person. You don't want to know, like they know you're smart because you've passed your step 1, step 2, you're there with all of those exams, so they know you're smart. They also want to know that you're a versatile person. You can work, but you can also do other things, like if they need somebody in a leadership role, you can do that. If they want somebody with good communication skills, then maybe if you're a debater, you can highlight it in that perspective, that you can do that. If you're doing like some extracurricular activities, then that tells that you can maintain a nice work life balance, because nobody wants just like somebody who's just working 24/7. They don't want that. So they want to have like a person who they can live with for the next 4 years. You're going to be spending so much time. So just like think about your CV. What is it that, if you're of your personality, that you want to reflect, and actively think about it. So very carefully pick and choose your experiences, and you don't have to like listen to what everybody else is saying. Do whatever you want to, and highlight from those experiences, highlight yourself.
That's awesome. Okay. So we have 10 minutes left. And I think with those 10 minutes, I have a question that I want to ask. So for people who perhaps had a plan to do something else, or who are torn between something else and psychiatry, what would your advice to them be to help come to a decision? And then after that, what I'd like is for each of you to give, your pearls of wisdom, 1 or 2 for all of us med students who are still in medical school. What are some of the things that you realize now, perhaps, that you might want us to know while we're still in the process? But yeah, the first question is more important because that's what I want to know. So, Dr. Yusuf, why don't you go first?
Yeah, of course. So, I mean, I just want to add to what Dr. Vakar said for the previous question, that the diversity of your experiences matters a lot. And I put my debating experiences and the fact that I have a blog on my eras, and that was something that was talked about a lot. And it often came up with this that, so this is a very demanding field. How do you think you'll be able to manage all the stresses of this field? Like, what do you do to de-stress, things like that. So then I would say, my blog is like a creative outlet for me that really helps me de-stress, etc., etc. So definitely put your hobbies and obviously put things that you are passionate about that you can talk about, because everything on your CV is fair game. And like, trust me, they go through it and they ask you questions about like everything. Like you think, oh, this is a very minor thing, no one's going to care about that, but some people do. So it's good to like know everything that you're writing on your CV and be prepared to answer any questions from anywhere. And then coming back to your question, people who are confused between psychiatry or some other specialty, I would say expose yourself more to psychiatry related, like just more clinical experience of psychiatry if you can get that. If you can maybe spend more time in the ward in your medical school, spend a couple of extra hours, do a little more reading. I think it would help if you can read about like the lifestyle of psychiatrists and things like that. That would really push you also, that there's like good work-life balance. And there's more ways to get involved. I think Dr. Vakar mentioned that in the beginning, that it has links with lots of other specialties. That's something that I like about psychiatry as well, especially the social justice and the social advocacy part of it. That's something that like really, really attracts me, that, there's so much more that I can do other than just being a doctor who sits in the clinic and sees her patient. So if you are the sort of person who likes, who is multifaceted, would like to be part of many different things, then I think psychiatry would be a good fit for you. And I think a good way to know that is to just do a little more reading, like spend more time volunteering, spending more time with psychiatric patients, maybe talk to a couple of other doctors who are psychiatrists right now. That will give you more insight. And then just gauge that with your personality and your long-term goals. If that is the field that if psychiatry is the field that aligns with that, then your choice will become clear. And if not, then of course there's like medicine is huge. You will find something that you love.
Great, thank you. Dr. Vakar.
Yeah, so I think I agree with Dr. Yusuf as well on this one, that, if you're not sure that psychiatry is for you or not, then I mean, don't apply for it as a backup. It's like, with the current dollar rate, I think it's very expensive to just like, take a leap of faith and be like, it's a backup field. If I don't end up anywhere, I just end up in psychiatry. So I don't think so. You need to do that. But I think if you really want to know whether psychiatry is the right fit for you, because I strongly believe that psychiatry is not for everybody. Like, if like nothing is working out for you, then you cannot just end up in psychiatry. You'll end up hating it. So I think in psychiatry, if anybody ends up, they either love it or they're just like they hate it. So for me, the deal breaker, that I want to do this was when I did my internship and like my house job in psychiatry. So I think that the most important factor is just do a lot of clinical experience, because I feel like our clinical experience, the exposure that we get in like our during our med school, is inadequate for us to decide whether we want to pursue this field or not. So, maybe do an elective somewhere in Pakistan. You can do it, like a lot of hospitals offer that. So, it's more hands-on experience and you get to learn a bit more, and that's longer exposure, and that would like, it would seal the deal for you, that you would know that is it the right temperament for you or not. And then I would say that it's always nice to reach out to people and talk to them, like your head of department or any other consultant that is working over there, that how has their journey been, how has their experience been. And if I feel like it's important that you talk to people who know you well. So if you've worked with them, talk to them, then they would know you, and like they're like very well experienced, they would like be a good like they would have a good advice for you, that whether this field is for you or not. So I feel like it's not something that one should take as a backup, that if nothing works out for me, psychiatry is there. I feel like that you'd be doing an injustice not only to psychiatry but to yourself as well, because it's a field that that requires a lot of dedication and a lot of work. So come in it if you're feeling it. If you're not feeling it, just don't do that torture to yourself.
That makes sense. I mean, and I think really you've both like the main idea is see more patients and find out how you feel about it, really. So on that note, I think we have 5 minutes left. So I'm gonna see if I'm getting any messages from behind. Am I supposed to take audience questions or not? I have no idea. While someone messages me and tells me, I think I'll try to put together everything that we've learned from both of you, and really thank you. This has been a really great session. So psychiatry is not a backup. Those days where people were just throwing in a couple of psych applications are over. This is a more competitive time. This is a time where clinical experience is hard to get but important. So give your exams, but you have to be a lot more than just your scores. You need clinical experience, you need a personality, you need to know where you want to work, who you want to work with, and all of that needs to shine through in your application. It's a long journey, but it has a good work lifestyle sort of balance. And really, you can become someone's lifeline. I mean, all of us know people who are really struggling, who are not, where they need to be. And psychiatry gives you the opportunity to change people's lives. And that's why all of us become doctors. So, I hope both of you are able to do that. I hope both of you become amazing psychiatrists. And I hope those of us who are clueless, I hope we get some clarity. And this session has gone a long way with helping us figure out what we want to do. So thank you again. And I still haven't gotten a message on whether I'm supposed to take audience questions or not. So, uh,
I think I'll add one thing to what
yeah,
you were saying. You summed it up very nicely. And, I would say that this process is long. So, have good mentors with you, have good support with you. And I think it's very important that at the end of the day, follow your gut feeling, because everybody is going to be doing a lot of different things. And you'll at one point feel like, oh my God, am I doing enough or not? And so I feel like, you need to shut everything out and just like go with the feeling that you know yourself best, and if this is something that you're choosing for yourself, then like just give everything your 110%, and don't listen to what anybody else is saying, that oh, you're just applying to psychiatry, or your personal statement is not good enough, or this is not good enough. If you feel like it's good enough and you've like had a couple of people say it's good enough, like don't show it to everybody, just show it to a couple of people who know you well, and they say like it's okay, and you feel like it's okay for you, like you're the best judge of self, then go for it. Don't listen to anybody else at the end of the day.
yeah. I think that's really important that especially as med students, it can be scary. You hear a lot of things from seniors, from faculty, from your family, from your colleagues. This is all of us, we're on this personal journey. We're trying to find out who we are and what we want to do. So ultimately you have to do it for yourself. So on that note, thank you so much, Dr. Yusuf. Thank you so much, Dr. Vakar, for your time, for your wisdom, for sharing your experiences with us. And everyone, remember, this session was brought to you by medschool.pk, premed.pk. So um yeah, sign up, subscribe, do all of that stuff. Thank you so much, everyone.
Thank you so much for having us.
Yeah,
Thank
thank
you.
you so much. Guys, enjoy the journey. Okay. I feel like you guys are like too worked up. Like, I don't think that was the atmosphere when I was in medical school. I don't know if that was the case for you, Dr. Vakar. But now, like, you guys are really stressed out all the time. Please have fun in medical school. These are like,
Yeah,
you're
that's
supposed
very
to have
important.
fun. Okay. And then just learn to enjoy the journey. Sab ho jata hai, match har cheez ho jati hai. You'll end up where you're meant to. But have fun in university. Enjoy. Like, this is your golden period. I'm telling you, once uni ends, it's like it's not the
You're
same.
gonna miss
Nothing is
it.
the same. You're gonna miss
Yeah.
it for sure. Absolutely.